My name is Angie Christensen, and I am the owner and creator of Simply Divine Eating, Simply Divine Healing. My story starts like most people in this world. I grew up in a very Western pharmaceutical medicine background. I lived a very typical American lifestyle, typical American diet. And by the time I was a teenager and an adult, I had all the typical consequences of that. By the time I was an adult, I had multiple diagnoses of things that there was no cure for, that I was just going to have to live with forever. I was on multiple prescriptions to just manage the symptoms of all of that. And then in my 20s, I ended up having 6 surgeries. And that was what was my final straw that led me to say, I am going to find a different way to deal with all of this. And I launched myself into the world of holistic healing to turn my own health around, and had the experience of watching that happen. The first thing I did was change food, change how I ate, change what I ate in a way that actually started supporting and healing my body. And I was able to watch diagnoses drop off, disappear. I got off all my prescriptions and this endless surgery stopped. And that was kind of my conversion experience, that the world of holistic health had the power to heal things that pharmaceutical medicine does not. And that was such an incredible transition for me. And it just has continued for me as I have had new needs pop up. And as I've become a mother, I'm a mother of 3 adopted special needs kids. So they have had lots of needs. And as life has taken us, I've just continued to learn to meet the needs for us, and then just continue to learn because I find it fascinating. So I have been trained in holistic nutrition, in herbs, in homeopathy, in energy medicine, in neurofeedback, in biomedical therapies, all sorts of different things. But for me, homeopathy is the one that works the fastest, the most deeply, and the easiest. And as a mom, that has been a huge thing for me, because as I said, the needs in my house are extensive and they are constant. And a lot of the other tools in my toolbox of holistic healing required more time than I could give when you multiplied that by all the people and all the needs in my house. And homeopathy is the tool that has allowed me to finally be able to kind of jump past that hurdle, because it's fast, it's simple, it's easy for me to administer. Even if the kids don't want me to, it's still totally possible. And it's allowed me to deal with things that we haven't been able to tackle any other way. So I want to share just 3 kind of examples from our family to show you how homeopathy can help with acute issues, with mental and emotional health issues, and with chronic issues. It really can touch deeply and change lives on all of those levels. And we've watched that in our home. So acute illness, my first experience with that was just a jaw-dropping experience for me with this was my youngest daughter that you can see there in the picture. We adopted her from Thailand when she was 6. She'd only been with us for a few months when she got really sick. And by that, I mean the type of sick that you mothers know, where they lay down on the couch and they don't move. They quit complaining, they quit talking, they quit eating, they quit doing anything, and they're just lying there. And the real problem I had was that we were supposed to be on a plane in 3 days. And so I had this really sick child, a child who I did not have a lot of background with, and we were supposed to be on a plane in 3 days. So she obviously had something, she either had influenza or something very influenza-like. And so I knew how to tackle that with herbs, but that would have taken me probably all 3 days. Like I didn't have the time to do that. And so I decided to try homeopathy with this illness. And I gave her a homeopathic remedy, and I waited about an hour and nothing happened. And so I tried a different one, and I waited about an hour and nothing happened. And I gave her the 3rd homeopathic remedy, and 10 minutes later, She was sitting up at our table eating, talking, eating, interacting, like just drastic change in 10 minutes. And by the next morning had no symptoms at all. We got on the plane and we went on our trip as normal. That was the moment I was like, okay, I'm hooked. And I have studied homeopathy every day since, because that was such an amazing experience. I have also seen it do amazing things for mental and emotional health. One of the really profound examples I have with this is with myself when we were going through her adoption process. International adoption is incredibly intense and incredibly stressful. And as you get to the very end of that process, there's just so many hoops and things that have to come together, and you're planning these incredibly complex trips. And in both of our international adoptions, as I've gotten to the end of those, I have experienced panic attacks. With this second international adoption, by that point, I had homeopathy. When I went into a panic attack and I was not able to breathe, move, do any of those things, my husband was able to get out some remedies and give them to me. Yeah, I kind of went through stages with that panic attack. Like the first stage was like, I can't breathe. And he gave me a homeopathic remedy that addressed that issue. And that calmed down. Like I no longer felt like I was going to die, but I started shaking. Like I just started shaking. And then my husband gave me a homeopathic remedy for that symptom. And then I can't even remember what the third one was. I wasn't with it enough to remember but then there's kind of a third stage. He gave me that one. And within 10 minutes, the whole thing was over. And each of those resolved extremely quickly, each of those stages, as he was able to give me a homeopathic remedy for that. I was just in awe, because I had experienced the panic attacks the other time and did not have that tool. And it was a completely different experience. I've also personally, I have been able to use them for severe depression, and within the process of a day, get to the point that it was like, oh, it was like someone had opened the shades on the windows again. It was like, oh, it was like the light went on and there was hope again and there was light again. And I thought, oh, okay, it's going to be okay. Somehow we're going to get through this. It's going to be okay. And to experience that lift of that, for those of you who know, that just that fog that you cannot see through, that there is no hope on the other side of that fog, and to feel that lift through a homeopathic remedy. And those are just two of many experiences we have had in our home with homeopathy and mental and emotional health. So it's so powerful and helpful for that, as well as for chronic issues. We've dealt with a lot of those, but one really simple story with us was also with my youngest daughter. She was born 3 months premature in Thailand with zero hospital or medical care. The fact that she survived is an absolute miracle, but she had massive health issues as a result of that. And one of them was chronic respiratory issues, which obviously born 3 months premature, that's not a surprise. So by the time we got her, she had pneumonia, I think 8 times, and she was diagnosed with chronic respiratory disease and all of these things. And when we brought her home, I remember the first time that she started wheezing, and we were able to give her a homeopathic remedy that stopped the wheezing, and she kind of rolled over and went to sleep, and that was the end of it. And so then the next time it started, we knew which one had worked, and so we gave her the same remedy and it stopped. And after a few times of going through that process, she just didn't ever wheezing again. And despite the fact that her x-rays show scarred lungs and all of these things, she now shows no symptoms of chronic respiratory disease at all. She doesn't get sick easier than my other 2 kids. She doesn't stay sick longer than my other 2 kids. She does really well. And I attribute that to the fact that we were able to address that with homeopathy. So you can see why? After having some of these experiences, I have been so excited, and I can't get enough. I just keep reading, I keep studying, keep experimenting. I just cannot get enough of this because of the enormous power that I have seen that it has in my own Homa. So today, here's the goal for our class. We're going to give you just a really brief intro into how homeopathy works. So for those of you who are new to this, and it may just seem weird or different, or you don't actually know how it compares to herbs or other holistic things, we're going to explain that for you so that you know how it works. And then we're going to get into specific remedies for injuries and first aid, common remedies for the everyday illnesses you face in your own home, and how to create your own homeopathic medicine cabinet. Okay, so why is homeopathy my favorite tool in my toolbox? Well, one, it is cheap. A homeopathic remedy costs about $6 to $10. You can use it for the rest of your life. So it is the cheapest form of medicine that I know of. It won't run out. There's a way you can do this so that you can keep using these homeopathic remedies so you don't have to constantly keep repurchasing them. So it is an extensive, long-lasting supply. It is fast. This is my favorite. I love herbs. I still do use herbs. I grow probably like 50 different medicinal herbs in my yard. I mean, I am a big fan of herbs. But when you need something to work fast, homeopathy can work in a way that herbs can't. And as I've already told you with those stories with asthma and panic attack, it can be so quick, and sometimes you need it to be quick. It is easy to administer. So if you've tried to get herbs into your kids, or all the vitamins or the supplements or some of these other things, it can be difficult sometimes to get people to comply who may not be on board or who may not be feeling well or any of those things. But homeopathy is easy. I love homeopathics in liquid. We'll talk a little bit about the different forms and what your options are, but I love them in liquid forms because I can just drop them. I can drop them on my kids' lips. They do not have to participate at all. And it's just so fast and easy, which is one of my favorite aspects of that. And then, of course, the big one, it cures instead of treats. And this I love, that story with my daughter and the asthma. When you treat something on an ongoing basis, it's eventually going to go away, because what homeopathy does is it goes in and rebalances the underlying imbalance that allowed that illness to develop in the first place. So you are then less prone to have that symptom or that illness in the future. And so it isn't a band-aid. It's the exact opposite of a band-aid. It actually goes in and allows your body to heal fully and deeply. When you look at all of these different conditions that we're used to just throwing band-aids on all the time, it's so nice to be able to go in and actually just fix the underlying problem. So what is a homeopathic medicine in the first place? So homeopathic medicine is a super dilution of a substance. So if you look at this picture, usually a homeopathic remedy starts with a tincture. Those of you who do herbs know what a tincture is. A tincture is usually a herb or a substance that has been soaked in alcohol to extract the medicinal contents of that original substance. And sometimes in homeopathics, they actually start with solids when they're working with minerals and those kinds of things as well. But you start with this mother tincture that they call that, which is the original extract of the substance. And then they take 1 drop of that and they put it in 99 drops of liquid. And then that is what is called succussed. They take that 99-to-1 ratio and it is pounded against something, a book or a surface. Boom, 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 boom. And that has a potentizing effect on this thing. Samuel Hahnemann, who is the original person who is credited with discovering modern homeopathy. It was that succussion process that was the key. If he just kept diluting things, they eventually lost their medicinal potency through the dilution. But what he found was that succussing process had a potentizing effect. And so you take 1 drop to 99, dilute, succuss. Then you take 1 drop of that dilution to 99, succuss. 1 drop of that solution to 99, and you succuss. And that process of super dilution is what makes a homeopathic remedy. There's a video you can go watch on YouTube from Helios Pharmacy in the UK. That's one of the leading homeopathic pharmacies, where they have a video that shows you how they make these in their pharmacy. It's an extremely precise science. It's a kind of a fun thing to go and watch. And you can see them go through this dilution process and see the machines they use, and some they succuss by hand and some are succussed by a machine. But it is a pharmacy that makes these remedies. And they can be made from anything. They can be made from a plant, they can be made from an animal, they can be made from a mineral, they can even be made from a poison, because medicines being made from a poison is not a new thing. Lots of pharmaceutical medicines actually have their origins in poisons. But in homeopathy, it works slightly differently in that because it is diluted so many times, you have none of the toxic effect of the original substance left in this super dilution, but the potentizing effect of the succussion and dilution process has maintained the medicinal power and actually increased the medicinal power through that process. So it is the process by which Samuel Hahnemann discovered that you could take things and keep the medicinal properties while avoiding any of the toxic risks that were originally part of many medicinal herbs and things like that. And my favorite part of all of this is that this is how everything on earth can heal. Everything on earth can heal. I took my daughter to the zoo last week, and we were in the reptile habitat, and we got to the one that had the bushmaster snake. And I just started smiling because, you know, my brain immediately went to the Latin of the bushmaster snake, which is lachesis, which is one of the leading homeopathic remedies. If you've got hot flashes, you want to meet lachesis. And I just looked at this bushmaster snake and thought, isn't it interesting that I'm in this building where everyone else is going, ooh, and I'm going, yay, because I knew what a homeopathic remedy of a bushmaster snake could do. And it's just such a cool thing that everything on earth can now be used to heal. It's just, oh, so cool. Now, homeopathy is backwards to how we are used to using medicine. It's based on what's called the law of similars. So modern medicine is based on the law of contraries. And what that means is that if you have a problem, we treat it by trying to create the opposite situation. If you have constipation, we treat it by giving you a medication that causes diarrhea. And we hope that somewhere in the middle, you'll come out normal, right? If your windpipe is starting to contract, we give you a medicine that causes it to dilate, and we're hoping that if we get all the amounts right, that it'll come out somewhere in the middle where we want it to be. But there's two major disadvantages to that approach. One is it doesn't fix the underlying problem. Whatever was wrong in your body in the first place to cause that situation to develop, or allow would probably be a better word, that situation to develop, it's still there. So you're still going to be prone to having that happen again. And the second problem is that because you've now put the opposite thing in your body, you've now thrown something else in your body out of whack. And this is why there's always side effects to medications, because we have treated one imbalance by deliberately creating a new imbalance. And there are always then undesired side effects of that because we create new imbalances of the body. And we're so used to that being normal, we kind of accept it as if that's just the way it has to be. Oh, okay, well, if I have to treat my high cholesterol with this drug, then that just means I have to live with the fact that my CoQ10 is now permanently too low, because that's just a side effect of the medication. And we've been so programmed that way, we think there's no alternative, but there is. There is an alternative. And that is that homeopathics work on the law of similars. And that is like cures like. And this is not new. Curing by opposites is what is new. Curing like cures like goes clear back to Hippocrates and the father of medicine, and it goes clear back to the Roman Empire, and it goes, I mean, that is the approach that has actually been used for far more of history than the law of contraries has. People thousands of years ago understood that like could cure like, and so they started to study, okay, if there is a plant that gives symptoms that are very like this particular illness, then that plant will probably actually help this illness. And so herbs, even toxic herbs, were used very carefully for thousands of years because they recognized that principle, that if you could match the effects that a plant would induce to the symptoms of a disease, it would actually treat that disease. Well, homeopathy makes it so much more simpler by removing any toxic risk to that, like you have when you use the whole plant. We can use all sorts of things to heal in a like versus like manner that we probably would never use the actual substance to because of the risks that accompanied that. This approach from a homeopathic remedy is like if you have a leak in your hose, instead of wrapping it with duct tape and trying to hold that water in until the duct tape breaks down and you just have to do it again, you're doing something that's repairing the substrate of the hose so that there isn't a leak. And it's just such a different approach that it has enormous power to help us with things that pharmaceutical medicine has not been able to help us with, because it is completely different. It's a little bit hard at first to wrap your head around how homeopathy works, and it takes you a while to get a feel of it using it, because the rules are totally opposite of how we're used to thinking. But once you do, it opens up a whole new world, because you can then start to go, oh, look, we could do something about this, or there is a way to support the body with this imbalance, or there is a way to help the body through this issue. It opens up a whole new world. If homeopathy is new to you, you may go, okay, so is this weird or is this uncommon? And the truth is no. Homeopathy is the second most widely used system of medicine in the entire world, second only, I think, to Chinese medicine. It's most commonly used in India and Europe. If you look at this map, this is where there are homeopathic hospitals and schools and things. There's a reason that it is not used more in America, and for that we have to go into a history lesson that I don't want to take the time to go. And if you want to go to school to become a homeopathic physician, it's a 4 to 7 year process, just like any other medical school is. It's incredibly precise science. It requires an enormous amount of education to become an expert. So this is not something weird. It's not something uncommon. It's just something that doesn't get much airtime in the United States of America. This quote is a great one that's attributed to Gandhi. It says, homeopathy cures a larger percentage of cases than any other method and is beyond all doubt safer, more economical, and the most complete medical science. And after the years I've spent studying and experiencing homeopathy, I wholeheartedly agree with him. To be good at homeopathy, you have to learn to stand on your head and think backwards. It just doesn't work the way we're used to medicine working. And if you've had negative experiences with homeopathy, this is probably why. I mean, I was first given homeopathics probably, 15 years ago, and I never had a positive experience with them. And that was because I did not understand the rules of how homeopathy worked well enough to use the remedy correctly, and it did not work for me. This is a really important part of education of homeopathy, is to understand how to use it correctly, because I think a lot of people, just like I did, discount homeopathy because they don't have a positive experience with it if they don't use it the way it's supposed to be used. We just don't have enough experience thinking this way. So let's see if we can help you with just a little bit of the paradigm shift that has to happen to understand the rules of homeopathy. Now, I think one of the most common misunderstandings with homeopathy is that it's like herbs. It's not like herbs. You don't use it like herbs. You don't follow the same rules as herbs. It is not the same. It is also not the same as essential oils. Essential oils are almost the opposite. Essential oils are a concentration of a plant, and a homeopathic is a super dilution of a plant. So even if you have a lot of experience with herbs and essential oil, you cannot transfer the way you use your oils and your herbs to how you use your homeopathic remedies. You've got to learn how to look at this a little bit differently. So homeopathy has a totally different set of rules. And the key one is less is more. Now, let me show you a couple of the ways that manifests in homeopathy so you can see how easy it is to not do this correct. Principle one of less is more. One drop has the same effectiveness as the whole bottle. I've had people ask, oh, my kid got the whole bottle of homeopathics and they swallowed it. Guess what? It doesn't matter. Homeopathy is based on the frequency of the dosage, not the amount of the dosage. Okay, let me say that again. Homeopathy is based on the frequency of the dosage, not the amount of the dosage. So you can take one drop of a homeopathic remedy or swallow the whole bottle, and it's the exact same dose. The amount makes no difference. So you might as well use one drop and make your homeopathic last longer. There's not an advantage or a disadvantage to using more. The second way this shows up that you need to understand is you don't need prolonged or frequent dosage. For example, let's talk about herbs and bronchitis. I use homeopathy on my animals all the time. It is so helpful. And here's a story of why. So we have goats, and we had a time when my goat got bronchitis. Now, my husband was out of town, which meant I was doing the kids all by myself. I was doing all the animals by myself. It's pretty intense when he is gone. And this goat started hacking, and I was like, oh, dang, this goat's got bronchitis. I do know what herbs I could have used to treat the goat's bronchitis, and they would have worked. There's nothing wrong with the herbs, but I would have had to go out 3 times a day for at least a week and pry this goat's mouth open and tried to force the herbs down its throat. And I couldn't do it. With everything I was managing with my husband out of town, there was no way that was going to happen. So I was like, okay, we are doing this homeopathically. We are not going to do this with herbs. And I went out and I took my liquid homeopathic remedy and I put a drop on the goat's nose. That's all I did. Just held it above the animal's nose, poink, let a drop fall on the nose. And most of my animals, when you do that, they stick their tongue up and they lick it off their nose. Then I watched him for a day. And by the next day, he was loads better, tons better. I was like, okay. So the next day I just watched. I didn't do anything more. I just watched. And then on the third day, it was either the third or the fourth day. I think it was the third day. I could kind of hear the cough starting to come back. I was like, okay, he needs some more. So I went out, I gave the remedy again on his nose, and that was it. And he was done. It only took 2 doses. Now, that's not always the case. I'm not implying that that's always the case, but in that case, it took 2. That's all it took. Now, if I'd been doing herbs or antibiotics, I would have needed to make sure that we hit it and we hit it and we hit it and we hit it, and we never left a break where the bacteria could have repopulated, right? You have to be really consistent with both herbs and antibiotics, and you have to make sure you go longer than the time in which they're sick to make sure that hopefully you've actually addressed the whole disease. That is not how homeopathy works. You give it as little as possible. Less is more. You stop as soon as you see improvement. That might take a couple of doses. And then as soon as things start to improve, you stop dosing and then you just watch. And if you see anything start to regress, you dose again. What should happen is that regression becomes less and less and less frequent until you don't need to do it again. That is the primary way in which homeopathic remedies are done. You don't just pound, 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 pound. Now, I do need to give just a little disclaimer here that there is an exception to that rule. As homeopathy is developed in the modern world, it's now being done in a lot of different ways. And the rules I'm teaching you are what are considered classical homeopathy here. But people are developing lots of different ways to use homeopathy, which I think is amazing. And I love studying all of them. And there's one clinic in India called the Banerjee Clinic. It's in Calcutta, India. And it's a clinic there that treats thousands of people a day. If you know anything about what Calcutta's like and what India's like, I've been there twice. It is indescribable, the masses of humanity and the chaos that exists in India. They just treat thousands and thousands of people. And so what they have developed in their clinic, what are called Banerjee protocols. The Banerjee protocols are an actual protocol of take this so many times a day for this long, do. And so that does exist as another approach to homeopathy. In some of my other classes, we get into pros and cons of that approach, but I am going to give you just a couple of those today. So when we're talking about something like that, I will specify that for you, that this is one where they have kind of created a protocol and you do follow it like you would a prescription. But normally in homeopathy, that's not how it works. You are using your own powers of observation to see, is this remedy working? Yes, okay, we have the right one. Do they need more? Are they improving? Are they regressing? And you are going to adapt how you are administering the homeopathic remedy based on what you see. So it requires you to be an observant, an educated, and proactive participant in the process. But the huge perk of that is, unlike some of these other things, you don't have to do this stuff a lot. Very often, small amounts are very effective. The last way that you need to understand this less is more approach, that's the opposite of what we're used to, is the more this has been diluted, the more potent it is. Later in the class today, we're going to talk about the different potencies of homeopathic remedies. The more times it's gone through that dilution process, the more potent the medication has become, because that dilution succussion actually increases the potentizing effect of the medication. So something that's been diluted 6 times is a very gentle homeopathic, and something that has been diluted 1,000,000 times is an extremely powerful homeopathic, and you have to treat them a little differently, but just be aware of that. The dilution is the number that you see on the bottle of homeopathics. If it says 30, it's been diluted 30 times. If it says 200, it's been diluted 200 times. If it says 6, it's been diluted 6 times. That's what that is. So the bigger the number, the more potent, because it's been diluted. So I want to stop there and just see if there's any questions on these principles of how to use a homeopathic remedy, because we want to make sure you understand the core way in which you're going to use these before we get into the specific remedies. Can you give a whole bunch of different homeopathic remedies at once? That is a very good question. Yes and no. Some homeopathic remedies play well together and some do not. Some actually will antidote each other, and some are contradictory, and some of them are cooperative. It is a thing you will see if you buy homeopathics, that often there are mixes that are made of some where they work together, or where they've put a couple of different ones to try to make sure they're covering multiple bases. But when you start, if you are starting using homeopathy, I would highly encourage you in almost all situations to do one at a time, just because you need to get a feel for how that works and start to see how an individual homeopathic remedy works before you start experimenting with mixing. But as you get more experience, yes, there are ones that work together. I'm going to give you in this class one example of a mix that tends to work really well. Is there any reason to give a lower potency versus a higher potency, or just a higher potency? Yes, you do not necessarily want to always give a higher potency. Absolutely not. There are times for lower potencies, and we'll talk a little bit about that when we get to the different potencies. Good questions. All right, let's keep going. So the key to homeopathy is matching what's called the symptom picture. And for this, you have to become much better at observation than most of us tend to be. Most of us have become very passive patients in our medical system, and homeopathy is the opposite of that. You've got to become extremely observant. When you're looking at a symptom picture, you are looking for the physical symptoms, the emotional symptoms, and then all sorts of little side things like what makes it better and what makes it worse. That's one of the key things you want to be aware of. Do they feel better when they hold still, when they move around? Do they feel better if you take them in fresh air or indoor air? Do they feel better if they are hot and you put them in a hot bathtub, or if they're in a cool room? What makes it better and what makes it worse are often some of the key indicators that will help you know which remedy will help you the most. You also want to look for things like what foods they're craving, what they're eating or drinking. Are they cold or are they hot? Dreams can be indicators in homeopathic remedies. I don't know if any of you have seen some of my Simply Divine Healing on my YouTube channel. And in that, I teach this principle that your body is a mirror. It is trying to teach you what to do to help it. And every symptom you have is a clue. And the more you pay attention, in some ways, the more clues your body will give you. You start to watch for all these things, understanding they're not random and they aren't bad. They're actual clues. I'll give you an example. I've got a really complex thing I'm working on with one of my kids. We're watching, we're working, we're trying, we're working with a professional homeopath. We're doing all these things. And I noticed that there was a pattern emerging that when something was really bothering him, when he was hurting, when he was really upset about something, the way he would describe it to me is, could we just cut that out? Like he would always use the word cut. And I started to see that happen over and over and over. And I'm like, okay, that is a clue. That is not random. There is a specific homeopathic that corresponds. And I was like, got it. I picked that up. I know that was a clue. Your body is trying. Like it is trying so hard. And one of the hard things about modern Western medicine is it teaches us to ignore our bodies and to suppress symptoms with medication instead of listening to them and going, okay, if I am always hurting there, instead of just trying to get rid of the pain, I need to figure out why I'm hurting there and what my body needs me to change so that I no longer hurt there. And really, if you're willing to follow that process with your body, it will help you heal so many things. So if you're interested in more of that you can go to, I think it's called the 4 Keys of Healing, where we talk about using your body as a mirror. But that's what you're going to want to do with homeopathy. So as we go through these individual remedies, you'll see that in some of them in the descriptions, I give you some of those clues so that you know how to use it. So what that means is, let's say 2 people in your house both have the flu, and one of them goes and locks themselves in their bedroom and grumbles every time someone comes and interrupts them and does not want to move and does not want to eat. And it's everyone go away and leave me alone. And you have another member of your family that has the flu, same physical symptoms, but the way they cope with it is this child wants to sit on your lap and they want you to hold them and they want comfort and reassurance. They need 2 different homeopathic remedies to both heal from the flu because the symptom picture is different. So you have to look wider than just the physical symptoms as you use homeopathy. And there's some of these first aid things we're going to talk about where that's not the case, where it's just pretty simple and cut and dried. But the more you get into some of these other illnesses and stuff, the more you need to be able to look at a big symptom picture. Now, 2 really important things I want you to understand about this principle. 1, this is how we know homeopathy is not a placebo effect. Because it's not that easy to find the right remedy. If it was really a placebo effect, it would work the first time, every time. I've had times with homeopathy where we get the nail on the head, the first remedy we try and things get better. And I have some I've been working on for a year and we still haven't found the right remedy. And everything in between. The reason you know this isn't a placebo is it doesn't work until you find the exact right match. The other key thing is this is also why homeopathy is not supported by Western medical studies, because in a study, they take a diagnosis and they give everyone the same thing. That's not going to work necessarily in homeopathy. Now, the exception again being the way that the Banerjee clinic is developing their protocols. One of the reasons they are developing those protocols is because they can be substantiated and have been substantiated with traditional double-blind placebo studies. Because if you do it that way, you can do it. But in traditional homeopathy, a study doesn't work. So if you go on and you Google homeopathy and all these things come up telling you that homeopathy is bogus, it's simply because you can't do it the way you do Western medicine, and you can't test it the way you do Western medicine. So if you try to come at homeopathy from a Western medicine, it's going to fail if you come at it from that approach. So if you see all that stuff, don't be alarmed. It's because they don't know what they're doing. You have to stand on your head. Now we're going to dive into the actual remedies, and I have some disclaimers first. Okay. I am not prescribing anything here. Okay. I'm educating and empowering. I believe in the thing of if you are prepared, you shall not fear. And if you know how to use these and you have them in your home, I promise you, your fear of illness and injury is going to plummet. Okay. This is so empowering to be able to do it by yourself. But what I'm doing is that I'm giving you a foundation of education and empowering you to do this yourself in the way that works for you and the way that you are comfortable. I am not prescribing anything. So I'm going to give you the most common remedies for some of these situations as dictated in homeopathic schools, homeopathic literature, professional homeopaths, all of those things. I am not telling you what to do in any way, shape, or form. Please understand that. And one of the beautiful things about homeopathy is it can be combined with any other form of medicine. You can be in the hospital on life support and still use homeopathy in conjunction because it has no drug interactions. Herbs do, but homeopathy does not. I just had a massive, almost died surgery that went badly last year, and you better believe I used homeopathy on the side of everything else I was being given. In any medical situation, you can combine this with anything else you feel you need to do. It does not have to be an either or where you're picking, well, I'm going to approach this homeopathically or herbally, or I'm going to approach this homeopathically or with a prescription. You don't have to pick. Homeopathy can be combined with all sorts of things. So I'm just trying to increase the tools that you have in your toolbox, and then it's totally your call on how you feel comfortable using it. My biggest piece of advice: practice when this isn't an emergency. Can I say that 10 times? Practice when this isn't an emergency. I can't tell you the number of times I've had people want to start using homeopathy when someone is super sick. It rarely works because they don't know how to do it well yet. And so don't wait until you have an emergency. Don't wait until someone has come down with the most recent flu-like illness that's going around to try using homeopathy. It will very likely not work. You have to get your mind and your body and your hands and your whole self into this until it starts to kind of click and make sense, and you start to get a feel of, well, should I redose that or should I not? And you start to get a feel with what kind of potency do I need to use? And that takes practice. So please don't approach this as, okay, Angie says I need these remedies in case I have an emergency. I'm going to buy those and I'm going to stick them in my cupboard. And then if there's ever an emergency, they're there. Please don't do that. It won't work. Okay. Homeopathy is a play with every day of your life kind of thing, because guess what? Something will come up every day of your life where homeopathy can be valuable. Your kid comes home from school and they got bullied. Is homeopathy valuable? Oh, yes. You know, someone skins their knee. Is homeopathy valuable? You bet. Someone gets a bee sting. You will have someone gets a headache. Someone gets a runny nose. between all the mental, emotional, and physical things that homeopathy can address, you will have something you could use homeopathy on every single day of your life. And the more you play with it, the more you will get a feel for it. So yes, please start to put together a homeopathic medicine cabinet and do it. Like, do it on the little stuff that comes up so that when you hit something big, you kind of have a feel for what to do. Okay, here's just some general tips. Start ASAP when someone gets sick. Another massive difference with homeopathy is you don't need a diagnosis. Modern Western medicine is based around a diagnosis. So I had a doctor tell me what they learned in medical school once. It was described this way. They learn how to take symptoms that the patient's giving them, match them with the right test. From the test, read the results and match the results to the right medication. That's what they're taught in medical school. Okay, so that process doesn't work if you don't have a test and you don't have a diagnosis, right? And so we've become very used to the fact that we need to have a label on something before we know how to treat it. That's not how homeopathy works. You are treating based on the symptom picture. So you could treat the symptom picture of an illness, and whether it is influenza or COVID makes absolutely no difference. It doesn't matter. You don't need a test yet. You don't have to wait till your test comes back to start treating it. So don't, as soon as someone is ill, start, because the sooner you start, and this is something that's equally true with herbal medicine, the sooner you start, the faster the person's going to get better. If you can hit things that first day when it's just something's off, I think they're getting sick, you will usually have it gone in less than 24 hours. So don't wait. You can just treat the picture without a name. Okay, tip number 2, only 1 drop is needed for a dose. So we talked about that. Again, you can do more, it won't hurt anything, but you only need 1. Try a remedy for up to 3 doses. If you don't see an improvement, try a different remedy. You probably don't have the right match. If you get the wrong remedy, nothing will happen. So when you give a remedy, there's 3 things that can happen. Nothing. The person gets worse, meaning more symptoms appear or the symptoms worsen, or the person gets better. If you have the right remedy, they can either get better or get very temporarily worse. Both of those mean that you have the right remedy. You can, with homeopathy, have what's called an aggravation. And a professional homeopath will tell you that an aggravation means you've got the right remedy. So don't, and they don't last a long time. It's not like you're going to put yourself in bed for 2 weeks kind of aggravation. But if very temporarily your symptoms get worse, you're actually on the right track. So how do you know you have the wrong remedy? Nothing happens. So what risk do you have to start experimenting with this? None. Now, when you get into the higher potencies, that's not the case, and we will talk about that. But when you're using these general low potency homeopathic remedies, feel comfortable experimenting. Nothing bad is going to happen if you give a dose of the wrong remedy. So feel free to just get in there and give this a try, and very soon you'll get a feel for how this works. Now let's talk about remedies. You guys probably read my story of my son, it's now been 2 weeks, who was sitting at the table. We were doing homeschool and having lunch, and he said, "Mom," and he went out unconscious starts sliding off his chair. I jump up, I grab him, his eyes are just glazed over, 0 response. So at this point, I don't know. I don't know if he just got dizzy and passed out. I don't know if he's having a seizure. I don't know if he's having a stroke. He has a history of all 3. So I take this child and I lay him down on a pillow on the floor, because if some of those others are happening, that's rule number 1, right? Get them safe. So I get him safe on the floor, and I grab my bottle of aconite. Its nickname is aconite. Its technical Latin name is Aconitum napellus. You're going to learn a lot of Latin as you do homeopathy. And so I grab my aconite, I put a drop on his lips. Like, I'm not trying to open his mouth. I'm not trying, I just let a drop fall on his lips. 3 seconds max. He starts blinking his eyes. I say, Josh, he says, what? I said, what's your name? Josh Christensen. What day is it? He tells me both the day and the date. I'm like, okay. So boy, did I watch him for the rest of the day. And if I needed to take further action, you better believe I would have. Using a homeopathic in no way means that I'm ruling out using any other help. It doesn't mean I would rule out calling an ambulance if I needed one, right? But it's right there and I can use it right then. It takes 1 second. And so in an emergency situation, the #1 remedy for anything that is sudden, that's its keynote characteristic for this remedy. Anything sudden is aconite. Okay, so that could be someone goes unconscious. That could be you suspect someone's having a heart attack. It's also really good if someone just gets sick really fast. Like they were fine an hour ago and now they are super ill. Anything that happens suddenly right at the beginning, aconite is your #1 remedy to use. The Banerjee Clinic in India says they have an 80% success rate of 0 permanent heart damage from a heart attack when aconite is given. The type of anxiety that aconite works for is the description is they think they're going to die. If you have someone who's got like a fear of flying and you get on an airplane and they start hyperventilating because they think they're going to die, that would be aconite. When I had my panic attack at that very first stage where I couldn't breathe and I felt like I was going to die, that was aconite. But there's plenty of other types of anxiety. So the key you're looking with aconite is they feel like they're going to die. But along those lines, aconite is also good for a whole family of people who have witnessed an emergency event, right? Like, so if you have something, you have a car accident, you have someone taken away in an ambulance, give aconite to everyone in the family because they just experienced a trauma from that sudden event. Also, their trauma is emotional, not physical, but aconite treats both the physical and the emotional of that sudden trauma. So you can use aconite for the other members in an emergency situation as well. All right, now 200C is the most common potency, meaning it's been diluted 200 times. The most common remedy or potency of this remedy that is used, and 200C is across the board my favorite, just all-purpose potency. But I have seen many homeopaths list that in their emergency kit, they have a 1M potency of aconite. The letters, an M is operating like a Roman numeral in homeopathic remedies. So it's that is something that's been diluted 1,000 times. A 1M is a 1,000. And the 1M is what I happen to give my son. Now, if he just had something little, would I probably reached for the 1M? No, but the kid was unconscious. So I reached for the 1M. That's a more potent version than the 200C. But that doesn't mean you have to have a 1M. If you've got something, use what you've got, right? If I'd had a 200C, that's what I would have used. But I do think that having a 1M of aconite is a useful thing. And the thing I learned from this experience with my family is put the aconite, whatever potency you have it in, somewhere where everyone knows where it is and you can grab it fast, because you don't want to have to rummage through your pile of remedies to find that aconite. So what I did after this event in my family was I took a bottle of aconite, I put a red label on it, and I stuck it up with the Band-Aids in the first aid cabinet. And I told all the kids, okay, next time when I say run and grab the aconite, here's where it is. Then I wouldn't have had to have left my son even for 1 minute to get the aconite. That is a recommendation that I have for you. All right, moving on to the next one. Remedies for injuries, surgery, and dental work. I've kind of grouped these together because there is a lot of overlap. But let's go through these. These are ones you want to kind of have memorized. These are some remedies that are so core to basic first aid stuff. You want to memorize these names and you want to memorize what they do. And so what I've given you here is they can do a whole lot more than this. If you went to the actual manual in homeopathy, there'd be pages and pages on what these can do. But what I've given you is their core first aid uses so that it's easy for you to memorize. So here's some things you want to memorize. Arnica is for bruises, circulation. One of the things the arnica does is it stops bleeding, and it actually helps the body quickly recycle the blood cells when they've gotten somewhere they don't belong and get them back to where they do belong. Because of that, it's incredibly good for bruises. And it's also great for IVs. I had to have, I can't even remember how many IVs, and I only had one of them bruised, and it was the one I didn't get a chance to take arnica before they gave it to me. So give arnica before an IV makes the world of difference, like a world of difference. Huge, huge, huge difference. The other thing arnica is fabulous for is injuries to muscle. That can even be just, I overworked, right? Like I went out and worked really hard and my muscles hurt. It can be a blow to the muscles. It can be any of those things, but arnica has an affinity for blood and the circulatory system and for muscles. It's an excellent heart remedy. It's used in heart disease kinds of things as well. But this is circulation, blood, and muscle. That's what you want to memorize with arnica. Arnica is probably considered the most commonly used homeopathic there is. Basically, if anything got bumped, bruised, or hurt, try arnica. That's one you all want to have. Now, Bellis Pranis is similar to arnica, but it's for deeper tissue injuries, especially in the abdomen. Deep blows, hematomas, abdominal surgery. This is the one you would use in place of arnica for those kinds of things. It's also great for tailbone. Someone falls and bruises their tailbone. This is the one that you want to use. And boy, is that an injury that happens all the time. Very similar to arnica, but works a little bit deeper, and think especially the pelvic, especially for the pelvic area. Now, do you guys know the difference between ligaments and tendons? Because as I was studying these homeopathics and learning them, I really had to go look that up to make sure I had it straight in my head, because they're different remedies. A ligament is connective tissue that holds bone to bone. So like inside your joints, it's what holds the different joint bones to each other. Whereas a tendon is what connects your muscle to a bone. It's what moves the bone. So if I go like this, that's a tendon working. Okay, but if I sprained my elbow, that's a ligament issue, because what I did was I damaged the connecting tissue within the joint. My joint got pulled too far, and I damaged the supporting ligaments. So it's really important in first aid with homeopathy to understand the difference between those two, because if it's an injury to your ligament, right, a sprain kind of thing, you want to use Ruta. And if it's an injury to a tendon, you want to use Ledum. Now, these all have longer names than this. I'm giving you they're short names. I'm trying to help you be able to memorize. Okay, so this is the short name. So you're gonna come to me and say, is this the same thing as Ruta graveolens? Yes, it is. But it's called Ruta. That's what everyone calls it, and it's a lot easier to memorize Ruta than to memorize its whole Latin name. Maria says, arnica helped my recurring headaches from a concussion several years later. Yeah, that is a really cool thing about homeopathy, that it will go back and work on repairing things that happened at birth and ever since. You can go back and treat. One of the principles of homeopathy is if there was ever an injury or a trauma that needed a homeopathic remedy to resolve and it didn't get one, and then you have a situation of like what they call in homeopathy never well since, meaning there have been now all these secondary issues that have arisen since that original injury or trauma. You go back, and instead of focusing on all these side things, you go back and you treat what needed to be treated years and years and years ago with the remedy it needed to be treated with back then. And you can see all the things that happened in the middle start to dissolve. How cool is that? So yes, totally true that you can go back and treat old stuff with homeopathy. Totally cool. Ledum is also used for puncture wounds, but we are going to talk more about that on its own slide. But I just put it there so you can help yourself memorize. Okay. Hypericum. I cannot live without hypericum. I never want to live in a world without hypericum. This is for nerve pain. Hypericum is St. John's wort. That's its Latin name of the plant, St. John's wort. So St. John's wort is fabulous, right, for mental and nerve issues, and so is the homeopathic remedy. This one saved my behind when I had my surgery, when even morphine was not cutting it. Hypericum made a big difference in my pain level. Another story I can tell you with hypericum is we had a time when my son got a wasp sting. And it was all swollen, it was red, but what he was screaming about was the pain. And he was getting all this shooting pain, nerve pain that was coming out of this sting. And hypericum like shut that off so fast. He went from just whimpering and whining and whatever to back to normal in about 5 minutes. And so, you know, then every time he'd start to say it hurts again, we just gave him hypericum again. And then 5 minutes later, he could go back to his normal life. Hypericum is so good for nerve pain. Oh, that is amazing. It's probably in my top 3 homeopathic remedies. That stuff is awesome. Staphysagria. Staphysagria, one of its keynotes is anything invasive. And this is emotional or physical. This applies in that it's really good for like clean cuts, like a knife cut. So a surgical cut, those just clean sliced kind of cuts, Staphysagria is fabulous for, but it's also good for any time either the body or the mind is mad about what was just done to it. So this is a big one after medical procedures and life kind of trauma. This is the one for bullying. This is what you want to give emotionally for things like bullying. Anything that feels like you have been invaded and victimized, this is the remedy you want. So that's physical or emotional. When I was treating myself for pain after my surgery, those are the 2 we put together, Staphysagria and hypericum. And oh my goodness, it helps so much. Okay, calendula. You guys know calendula, right? This is an amazing herb that's fabulous for skin, and same goes for the homeopathic version. Cuts, scrapes, burns, infections. It speeds up the healing of the skin, and it treats infection. I've treated an abscess with homeopathic calendula, one that was in a place you couldn't get to it, like, right? Couldn't get to it to put a pack or a poultice on it, but calendula homeopathic I was able to use. Phosphorus is great for detoxing anesthesia. So boy, have I seen this work on a lot of people. So if you've got any medical procedure and you want to help process through that anesthetic faster, phosphorus is great for that. And that includes the dental anesthesia after you've been numbed up for a dental procedure. It's great for that. That's actually one of the first homeopathics I was ever given. I actually had a dentist give me phosphorus and told me to take it home and take it after a dental procedure. And I was like, wow, this is cool. Okay, pyrogenium. This is a homeopathic for sepsis and serious infection. This is a very potent homeopathic remedy. This isn't one you would play with. And I've never had a human being in my family get sepsis, but I have had a goat get sepsis, where we had a super traumatic delivery over multiple days that ended up with a vet having to be called and cut the baby out. Like it was awful. And he gave that goat, even with everything he did, only a 50% chance of surviving. And we gave her pyrogenium for the infection, and she made it. That's my only experience with that remedy personally, but there again, it's one I would have in my emergency kit. So let me give you an example now of how you could put these together. So my son got braces on. a couple weeks ago. Okay, so let's talk about what are some of the things that are going to happen to the body when it gets braces. Well, first of all, it's going to be mad. Like, that's incredibly invasive, that not only are you sticking this stuff on it and creating all of these like open wounds in the mouth, now you're pulling on the teeth, right? Like, so you're putting pressure. This is an incredibly invasive thing for the body. And sometimes we really underestimate how our body feels about some of these things that we do to it. So staphysagria, great for when the braces get put on and every time the braces get tightened, because it's going to help the body let go of that, what the heck did you just do to me, and instead just more quickly settle into its new location. Pain, there's some serious pain when you first get your braces, so we used hypericum. And then there's bruising and poking and just general achy stuff going on too, so we used arnica. Now there's probably other ones you could use as well. Some people recommend ruta because you are pulling on like almost the ligament type of stuff in the jaw, but for us what I used was arnica, hypericum, and staphysagria, and he got through it so well. Like, he only ever got one sore in his mouth, and he had no pain at all within 3 to 4 days. Like, it was amazing to me. And we did it on demand. I didn't have a set protocol. It's like every time he says, "Mom, I'm hurting," we followed the symptoms and we treated what was hurting. And at each day, it just got farther and farther apart until by day 4, he didn't take anything anymore. It was amazing. So there's just some examples of how, if you understand these key aspects to some of these basic first aid homeopathic remedies, then you can start to understand in what situations you would use them. Okay, let's talk about bleeding. So here's an example of symptom picture. Now, if you've just got a nosebleed, you just got kind of a generic bleed, and there's no really distinguishing symptoms. If it was me, the first thing I would try is either phosphorus or ferrum phos. Phosphorus, right? That's a mineral. And ferrum phos is iron phosphate. So it's the combination of iron and phosphorus. So these are both mineral remedies that have to do with blood. And so they work really well with blood. And so if I just had a kid with a bloody nose or something like that, and they skinned their knee and we're trying to stop the bleeding, I would personally probably first try either phosphorus or ferrum phos, because those are just good for general bleeding. But a couple that are good for more specific types of bleeding. Arnica, we already talked about, is for bruising. It's going to help the body pull out all those blood cells that are caught under the skin, recycle them, clear them out, and clean the wound up. Chena is a really fun remedy. Okay, this is the homeopathic version of quinine, essentially, the plant that quinine comes from. And so it's a malaria remedy, but it's also used for anything where the symptoms are coming primarily from the loss of fluid. So that could be someone who's really struggling because they've lost so much fluid from diarrhea, someone who's really struggling because they've lost so much fluid from bleeding. It's where you start to get other symptoms, but the primary cause of those symptoms is loss of bodily fluid of some kind. I've even seen homeopathics recommend this for women who are struggling with some side effects or emotional effects of nursing, because they're struggling from the loss of an enormous amount of fluid. So that's its keynote. So if you have someone who's lost a lot of blood and so they start having additional symptoms from that loss of blood, then you would want to look at Chena. Carbo-veg is the homeopathic of charcoal. Like, this is a fun one. What are some things you would use charcoal for? Well, we now take charcoal, right? Activated charcoal capsules when we want to detox, when we want to help stomach issues, and Carbo-veg is used for similar things. But some of the keynotes for it from a bleeding point of view is that you've got a steady oozing of dark blood. The person is cold and clammy, and air hunger is a really common symptom of carbo-veg. So that means people are doing this, like they can't get enough air in. Carbo-veg has been used a lot with the current illness going around for that reason. So anything where the person just feels like they can't get enough air, they start doing this, then you would want to look at carbo-veg. And ipecac, if the bleeding is accompanied by vomiting. So you guys know what ipecac, right? That's an herb that will induce vomiting, but the homeopathic does the reverse. Homeopathy blows my mind on so many levels, but here's one of the ways homeopathy blows my mind. If a plant or the original substance that you worked with does something, primarily something good, the homeopathic does that same good thing in an amplified way. If the original substance does something we consider bad, the homeopathic remedy tends to do the opposite. It's just, God's creations on this earth have a divine intelligence that is amazing. And homeopathy taps into that divine intelligence within these divine creations. And that's one of the reasons I believe it is so powerful. So ipecac, if you take the original plant, you're going to throw up. But ipecac, the homeopathic, stops you from throwing up. It's a key vomiting remedy. But it's also for any symptom that is accompanied by vomiting. So if you have someone who is bleeding and the consequence of that bleeding is that they start throwing up, that's how their body shows you, right? The clue of how they're responding to the bleeding is by vomiting, then you would want to use ipecac. Next slide. Broken bones and sprains. Okay, so this is one where I'm going to show you here an actual protocol that has been advised for broken bones and sprains. Do you have to follow this exactly? Absolutely not. If you wanted to move through some of these faster, if you felt that's what was needed, go for it, okay? This is just sometimes when we're not exactly sure how to manage a situation homeopathically, it's kind of nice sometimes to have a basic guideline to fall back on. And that's what this is, okay? This is kind of a basic guideline. So the first thing you're going to want to do is arnica, because if you've got a broken bone or sprains, you've also got bruising and trauma in there and swelling, and arnica is just a great all-purpose thing to use for that. The second one you would want to look at is ruta, because you're going to have injuries to ligaments. Ruta also treats injuries to the lining of the bone. So whether it's a broken bone or a sprain, you're going to want to use ruta. Then symphytum. Who knows your Latin? What's symphytum? Comfrey bone. There we go. Okay, this is the homeopathic of comfrey, and comfrey is known as bone knit. Now, what this means is don't give symphytum before the bone is set and cast, or it might start healing together really fast in the wrong spot. You got that? So that's why in this protocol, they're saying not to add symphytum until day 3, because they're assuming you need some time if you broke your bone to go get a cast put on. You do not want to give symphytum until the bone is in the right place, because it is going to dramatically speed up the cell division in that bone and how it heals. So wait until your bone's in the right place and then throw that symphytum at it. And if I had a broken bone and it was me, I would be taking symphytum every day until that cast came off. Because you're, like I say, you're aiding the body in being able to recycle bone. So just like arnica recycles blood tissue, symphytum recycles bone fragments. Like it actually goes in there and pulls out all the little bone fragments that aren't where they're supposed to be and helps put it in the right, like it's phenomenal. Anyway, so add the symphytum after your bone is in the right place. You can also add the mineral calcium phosphate, in homeopathic form to help, because that's going to help the body more efficiently uptake and use calcium phosphorus to have the ingredients that it needs to put into the bone. There's kind of a protocol you can follow with broken bones and sprains. Now, would I hesitate to give ruta the first day? Absolutely not. Like if I felt like that's what needed to be done, I'd totally do it. This is just kind of a basic guideline to help give you a place to fall back on. Now, some additional options, you've got eupatorium, It's also a plant that it's been used for thousands of years for bones. And it is really good for deep, deep aching. So the aching, either because your bone is broken or the aching where you feel like you've got a broken bone. So eupatorium is also used in the flu when people like hurt so bad that it feels like their bones are broken. Eupatorium can make a huge difference there. So that's another option you've got to add on if needed. Hypericum, if you've got nerve pain involved anywhere, which you may have if you've damaged or crushed nerves in an injury, hypericum can help a lot. And then bryonia, also another one that's used in the flu all the time. But the keynote for bryonia is that movement makes everything worse and that tight pressure makes everything better. So if you've got someone who's got a sprain or a broken bone and they're like doing this, because the harder they push, the harder the tighter they wrap the bandage, the better it feels, use some bryonia. Because if the person just, it's like, don't touch it, I can't move it, I've just got to hold it as tight as I can, that's a sign that bryonia could be really, really helpful. So those are a couple other bone ones you've got based on what you're having. So someone says Calphos 6X. Yes. When you're trying to actually give the body ingredients to make, mineral ingredients to use in a construction type way, you want to use it in a very low potency. And the most common potency for that is 6X. So yes, that's what I would use for the Calphos. When you say add the remedy, do you continue taking the prior remedy? Yes, if the symptom that remedy is needed for still exists. If that symptom has resolved, then let it drop. Homeopathic treatment is purely based on symptom need, right? So for example, if you had super deep aching from a broken bone and you were using eupatorium and you got a couple days into it and you've got a cast leg, right? Okay, let's say you've cast your leg, you've gone into the doctor, they've cast it, you're using your symphytum, but you're also using eupatorium because it hurts, like you just want to scream. And then after 3 days, that part goes away, then quit using the eupatorium and keep using the symphytum to help the bone until the bone is healed, because that's your symptom with symphytum, right? The symptom of whether you need the symphytum is, does the bone need to repair? So your symphytum, you would keep taking because the bone's still repairing the break. But as soon as the symptom of the pain for the hypericum went away, quit taking the hypericum, or the need to hold it tight. If that disappears, then you stop with the bryonia. So yeah, you can add, meaning that in the same day you might be taking multiple remedies to meet your needs. But if symptoms resolve, quit. Okay. Good question. All right, burns. These are the top 2 remedies for burns. Urtica urens and cantharis, and it depends on whether it's a 1st-degree burn or a 2nd-degree burn. If it's a 1st-degree burn, so that there's no blistering, it's just a mild burn, then you want to use the I don't speak Latin, so I honestly don't know if it's urtica or urtica. But either way, it works. So you're going to use that for your 1st-degree burn, and for your 2nd-degree burns, to both prevent or to treat the blister, you're going to want cantharis. Those are your 2 most used burn remedies. But just a couple other options as backup if you need it. For a non-healing burn or an old burn that's never completely resolving, or one that's just really deep, really painful, isn't progressing the way you want, then the remedy for that is causticum. A couple others you can use depending on if the symptom picture matches, right? Apis. Apis is for anything that's swollen and itchy, like a bee sting. Apis is a bee. That's what it is. So anything that looks and acts like a bee sting, you can use Apis for. So if you had a burn where it was more pink, swollen, and itchy, rather than painful, and cold really helps, then Apis might be useful. Belladonna, its keynote is hot and red. Okay, that could be an ear infection, that could be a sore throat, that could be a burn, it doesn't matter, but hot and red are the things that you look for and you think maybe belladonna would be good. So that could in some occasions be helpful. And then of course, hypericum, if you've got some nerve involvement there so that the pain is more stabbing and shooting. Nerve pain tends to move, and it tends to move down from the brain to the body. So if hypericum is going to be useful, you're going to likely have shooting pain that moves outward from the body, following the path of the nerves away from the brain. Those are ones that could be helpful in a burn situation. You can use the actual herbs on the burn directly as well. You could put the homeopathic on the burn too, but you don't necessarily have to. You're just trying to get it in your body, and then the body will respond as it needs to. Julianne says that she used Passiflora on an oven burn and it was amazing. So good. There's another one that is helpful. Thank you for sharing. That is awesome. I'm in a lot of homeopathic groups, and it is just interesting to see, you know, people will put up and say, okay, here's my situation, you know, what do you think? And you get all these different opinions, and they can be drastically different sometimes, but it's interesting as people share experiences of what has worked for them. They're cool stories. Bites, stings, and puncture wounds. Okay, the first one, anything that's a bite, sting, or puncture wound, the first thing you're going to think of is apis. That's the bee. Okay, so apis is for anything that's red, swollen, and hot to the touch. It's going to look like hives or look like a bee sting. So there again, does it have to be coming from a bee sting for apis to work? No. But if the symptoms that are appearing look or remind you of a bee sting, then like treats like, and apis can be very helpful. If you're dealing with another type of puncture wound, then the first one you're going to think of is ledum. Ledum, in general, those don't tend to be hot to the touch. They have more of a coolness to them, but we don't need to get into that many specifics. Other puncture wounds, ledum is one that you want to look at. Ledum is the one you want to grab for a tick bite. This is a protocol, not mine. This is the protocol, the Banerjee protocol for a tick bite is ledum 200 every 3 hours on day 1, 2 times a day for a week, twice weekly for a month, and once a week after that. There's an actual protocol for you if you want to follow if you deal with a tick bite. I have read of homeopaths that say that has been extremely effective in preventing anything evolving from a tick bite or even tetanus as well. So those are good ones to have in your emergency kit, because no matter what you get bit with or poked with or whatever, those can be really useful remedies. And there again, homeopathy works on past things. So if you are dealing with an illness that has evolved from a puncture wound in the past, then ledum would probably still be something that you would want to look at. Okay, tummy trouble. Let's talk about things you can do for your tummy. Ipecac for constant vomiting or any situation where pain has induced vomiting. So we talked about if bleeding creates vomiting, then you would use Ipecac. If childbirth pain is creating vomiting, you would want to look at Ipecac. Anything where pain is leading to vomiting, Ipecac's a good contender. It also tends to be more of a constant vomiting, whereas Nux vomica, I mean, that's easy to remember because it sounds like vomiting, right? It tends to be for that type of vomiting where you feel like you want to throw up, but you can't, or you throw up just a little bit, but throwing up doesn't make you feel any better. Dry heaving, that kind of vomiting. That one saved my behind also in my last surgery, because that kind of nausea is how I respond to anesthesia. And I could take this and it shut down the nausea in 5 minutes every time. And I had to take it a lot of times, but it would shut down that vomiting in 5 minutes. Like that feeling like I needed to vomiting, those dry heaves. Oh, that was so helpful. Another thing Nux vomica is famous for is for overindulgence. So overindulgence in food you probably shouldn't have eaten or that wasn't good for you, overindulgence in alcohol, like it's the overindulgence illness remedy as well. Arsenic and album is your traveler's diarrhea, your Montezuma's revenge, your food poisoning kind of stuff, diarrhea and vomiting from those kinds of things. That type of situation, arsenic and alum, like I would not travel without arsenic and alum. Well, I wouldn't live without that one. I need that one a lot, but that's a great traveling one to have with you. Cocculus for the motion sickness kind of nausea. Carbo-veg we talked about earlier for bleeding. Remember, carbo-veg is charcoal. That's the homeopathic of charcoal, and therefore is really good for gas and bloating and belching. I can tell you an interesting story of carbo-veg. One of my kids used to get gas really bad every time they ate oats, and that gas means you've got incomplete digestion. That's the definition of gas. So your body is having trouble digesting something if you have gas. But with him, after a while, we kind of quit doing oats with him because obviously his body was not handling it that well. Well, he got some oats and started having gas, and I gave him carbo-veg, and it worked really, really well. And so the next time he had the oats, we gave him carbo-veg, and he did really, really well. And after a few times of that, he didn't need carbo-veg with oats anymore. So there again, there's that. It's actually fixing the imbalance that's causing the original problem, not just treating symptoms. So cool. Chino, we've already talked about, is from symptoms from loss of fluid. So if you start to get additional symptoms because you vomited so much or you've had so much diarrhea that then there's dehydration symptoms happening and other things, then Chino might be a good one to give a try. Now, here's a great general tummy combo. And if you own these 4 remedies, you can just mix them together in a bottle yourself. You don't have to buy combos. You can make them yourself. Just put a little of each of them in a bottle. Arsenic and alum, Epicac, Nexvom, and carbo-veg. It's one of those where it just kind of covers all the bases for tummy issues. I had a goat, there again, having tummy issues and bloat and stuff this morning, and that's what I gave him. I just gave him that combo. It was a really easy fix. So if I had pellets and not liquids, the way I would make a combo is the liquid base that I use is 50% filtered water, 50% vodka. The water is what carries the homeopathic remedy. The alcohol is just in there to prevent it from going bad, from allowing any bacteria to grow in your liquid remedy. That's all the alcohol is doing. So I use a 50-50 combo. And what I would do is I would put my mix of vodka and water in a bottle, and then I would put some of all the 4 different kinds of pellets in there and just let the whole thing dissolve. That's what I would do if I was doing a mix with the pellets. Can you put the pellets into water and just drink? Yes, you can. That's actually almost its kind of own field of homeopathy, doing what they call water dosing, where you put it into a drink and you just sip it over the day. It's kind of considered a more gentle way of doing it because it's kind of diluting and spreading it out over a longer period of time. Some people feel that works better for some things, not as well for others. I've never gotten that into that debate personally, but absolutely that is a way you can choose to take a remedy, is to just put it in your water and then sip it through the day. Someone's saying, what brand of vodka do you use? It really doesn't matter. The reason vodka is used is you want the most boring, plain, unflavored, basic alcohol you can get. Because when you're doing a homeopathic, you don't want to be adding stuff to it. Just get the most boring vodka you can get. The one I tend to use is an Austrian potato vodka because that's gluten-free. It's also European, so I'm guessing it's cleaner as far as pesticides and GMOs and things like that go, because there's a lot stricter regulation of all that stuff in Europe than there is here in America. But the type of vodka is not critical in any way. Okay, moving on. When someone starts to come down with something, you can tell someone's getting sick, but you don't know what's wrong. The symptoms haven't developed yet. What can you do? You know, and you guys know you, and you know your body, and you know your family's body. I have certain kids where they get really ornery. It's like, oh, you're getting sick, because there's no symptoms yet, but they just get ornery. For me, I get exhausted. There's a certain type of exhaustion that I get where I'm like, dang, I'm getting sick. What do you do when you can tell you're coming down with something, but you have no idea what it is? Well, of course, one of the first things to hit it with would be aconite, right? Aconite is considered only to be used in the first 24 hours of an illness. If it hasn't resolved it in 24 hours, you need to move on to something else because it's only for things that are sudden. And after 24 hours, something's not sudden anymore. You need to move on to a different picture. But when you're first coming down with something, I have had times where aconite has stopped someone from getting sick. I have seen that. I have also seen that happen for ferrum phos. I have in particular one kid who seems to respond really well to ferrum phos. And interestingly, he's my child most likely to get nosebleeds. See, there again, hints. There's hints and clues everywhere. If I give him ferrum phos right at the beginning of an illness, it often never materializes. But my new favorite, I have to tell you guys about my new favorite remedy because I didn't even know this thing existed until our recent flu-like illness happened. It's called hyposanium. And it's one of the ones I found when I was researching remedies for the current flu-like illness. And I started trying it and oh my goodness, it works for so many things besides that. This is my new favorite remedy that I give someone when they're starting to get sick. And I cannot tell you how many times we've kicked something in 24 hours with this sucker. I love this remedy. Like it's my new favorite toy. And so I'm still kind of experimenting with it, but by nature, it is one that targets the respiratory system and swollen lymph glands in the neck under the jaw. And so you can tell that that would hit a lot of different types of illnesses, that it's going to be a focus on respiratory and glands under the jaw. So it's also one I use a lot now. I think it's really fun. So what are you doing with potency with these? Well, your most normal potency would be to do a 200C a few times during like 3 times a day when you can tell someone's getting sick. If you feel like you need to hit it harder than that, remember it's not always better to use a higher potency. So I'm not saying that. However, I will tell you that I have found a 1M of hyposanium to be really good at just knocking things out at the beginning, at least in our house. And I really do think different bodies respond differently. So I think there's probably some people who respond much better to lower potencies and some that respond better to higher potencies. But I do like the hyposanium. I have had a lot of luck with that in a 1M given once in the morning, once in the night. And a lot of times that's been all it's taken. Okay, fever. So now we're leaving injuries and we're getting into just your common at-home illness issues. If it's a sudden onset and they tend to be kind of nervous, you're going to look at aconitum, right? Anything sudden, hit it with aconite right at the beginning. Belladonna, remember its keynotes are hot and red. So it's going to be a really high fever and their face is probably going to be red if belladonna is the right match. Ferrum phos is the next one if it's not quite as dramatic as either of the other two. It isn't as sudden, it's not as high, or belladonna hasn't worked, then you go to ferrum phos. It's kind of just like ferrum phos is kind of for your non-generic bleeding things. Ferrum phos is also for kind of your non-generic illness things, or non-generic is not what I mean. Generic, non-specific symptom kinds of situations, ferrum phos can be really helpful for. So there's your key fever remedies. Now, does that mean that's the only thing you might ever need for a fever? No, but I am trying, if I gave you guys 10 possibilities for each of these, it would be overwhelming. So I'm trying to give you the most common ones that you would always probably want to start with. If those fail you, then you can look broader. But I'm trying to give you the key ones that are probably going to be what you want 90% of the time. Okay, acute strep or ear infections. Here again, this is actually a protocol. Belladonna first, and then just alternate it with Hep sulf. Belladonna, Hep sulf, belladonna, Hep sulf. If it was me, I'd probably do it like every 2 hours. Do one, 2 or 3 hours later, do the other, 2 or 3 hours later, do the other, 2 or 3 hours later. 2 or 3 hours later, do the other. You want to get them in a couple times a day. And that's a really good first line approach to strep and ear infections. Strep is always the same, right? It tends to manifest always the same. Ear infections, that's not the case. They can be very different. There can be teething ear infections. There can be cold ear infections. There can be, you know, all sorts of things. So I've given you a few other possible remedies that are very common with ear infections if the belladonna hep salt doesn't do it for you. Chamomile is a key child remedy for lots of childhood illness kinds of things. And the keynote with chamomile, this is chamomile, right? So chamomile tea is to soothe. So chamomile is great when they are just whiny and irritable. When chamomile is going to be effective with an illness, they are just going to be whiny and irritable. And two other things that often pick up with kids is that they want to be carried all the time and they arch their back when you pick them up. Either of those appear, those are really good indicators that chamomile will be helpful. Pulsatilla, on the other hand, is good for ear infections that come from a cold. And these are the kids that want to be held. They're not obnoxious and irritable and whiny, like they just want me, hold me, right? Like they're tearful and they want to be held is more the picture, the symptom picture of pulsatilla. Now here's two of my own observations. I have dealt with a chronic infection in the bone, the mastoid bone behind my ear. And one of my own just personal observations is that mercurius is really helpful for right-sided ear pain. And capsicum, that's red pepper, that's like cayenne, is really helpful for left-sided ear pain. So if you have an ear infection that's only, or ear pain that's only on one side, you might want to look at those two as a possibility. Can homeopathy be used during pregnancy? Yes. There are some debates on a couple remedies, like just not very many. There's a few. For example, silica. What silica is, its objective is to dislodge foreign substances. So it's generally not recommended to take that during pregnancy. You don't want to dislodge foreign substances, but there's not much homeopathically that you can't do during pregnancy. There again, if you're concerned about that, it would be great to talk to a professional homeopath and run that by them. There again, opinions don't tend to be consistent on that one. Just like on herbs, you know, there's some herbs that it's like, absolutely don't take while you're pregnant. And this person's like, I've given that to 100 women when they were pregnant. They were fine. You know, it varies a lot. So you're going to have to decide who you want to consult on that. But yes, 99% of homeopathy can be used on babies, on pregnant women. Age does not make a difference in how you dose with homeopathy. So you can do it even with little babies. Okay, croup. All right, croup, these tend to go through stages. And this is one where there again, it's so predictable that there's almost a protocol that's been developed just because it's so predictable. In that first stage, in the first 24 hours, where it's the dry, choky, croupy cough and they're anxious and whatever, hit it with aconite. When you get to the second stage, you're going to want to look at what the cough sounds like. Spongia is for a rasping cough that sounds like a saw through a board. Okay, if that's what it sounds like, you're going to want to use that. If it sounds like a bark, you're going to want to use the Drosera. So in that stage, it's going to depend on what the cough sounds like. And then when you get to the last stage, Hep sulf, again, Hep sulf is for infection. That's what it's for. So that's why we're using it in ear infections. That's why we're using it in strep throat. That's why we're using it in croup. In this one, you don't continue the last stage. Like you do this one for the first 24 hours. Then when it sounds like this, you do this. And then when the cough changes, you quit the previous remedy and you move on to the next. Because you're talking about stages with very different symptom pictures. So unlike the broken bone, where you would be continuing the previous remedies through the protocol, this one you're going to be shifting because the symptom picture shifts. Okay. I used silica cell salt around an infection on my leg and it pulled out a stitch that didn't dissolve. Yes, silica is what we probably actually should have put that in here. Silica is for splinters. If you've got splinters, anything like that, something that's gotten lodged in the skin and stuck, silica is a great first aid remedy. It will pull stuff out of the body that doesn't belong there. But there again, if you've got something in your body that doesn't belong there, but you want to keep it, like prosthetically implanted kinds of things, then you're not going to want to take silica because it could pull things out that you're not wanting it to. Okay, let's talk about influenza-ish diseases. Okay, it doesn't matter whether it's influenza A or B or the recent influenza-like disease. It doesn't matter what its name is. With homeopathy, you're looking at the symptom picture. So who cares what it's called? If you want to get tested, get tested. If you don't want to get tested, don't worry about it because it doesn't matter as far as a homeopathic treatment goes. All of these are going to have fatigue, the exhaustion, the achy, the fever, right? All of these are going to have that. But which of these remedies you use is going to depend on a few distinguishing features to get the symptom picture right. So I've tried to make these as brief as I can while still giving you some of the key distinguishing features so that you would know which one you would want to use. Okay, now, just so you know, there again, diagnosis doesn't matter. So these also work for things like CFS, chronic fatigue syndrome. If the symptom picture matches, that's what matters. It doesn't really matter if it's caused by a bacteria or if you've got a chronic illness, it doesn't matter. You're just trying to match the symptom picture. All right, so gelsemium. The key word with gelsemium is heavy. I've had this one. I know what this feels like. A lot of you probably do. It's like, I cannot lift my arm. Like my arm feels so tired and heavy. I can't lift my arm. Or the eyelids tend to be so heavy that they can't open their eyes all the way. So that's how the exhaustion is manifesting, is in just this heaviness. There also can be trembling or paralysis. So shaking, this is the remedy my husband gave me in that second stage of the panic attack where I started shaking. Trembling goes with gelsemium, as does paralysis. In my more in-depth homeopathic classes, I tell you a lot about my one child where this was a key remedy for them based on trauma because their reaction to trauma is paralysis. Those are other keynotes. And one of the things that can really help you with flu-like things is what is happening when they drink. So on almost all of these, I've given you what the keynote is having to do with drink because it's kind of distinguishing. Gelsemiums are called the camels of the homeopathic world. And my son, who's very much a gelsemium personality, he never drinks unless we make him, like he will go days. He does not drink ever. And that's kind of a distinguishing characteristic of gelsemium. So if you've got someone with the flu and they never want to drink ever, you would probably want to look at this and see if some of those other symptoms match. Now, on the flip side, let's go down to bryonia. These people have occasional intense thirst for huge amounts. So they're not drinking all the time, but when they do, they want to guzzle. Is one of the things. And there again, no one ever has all the defining characteristics, ever. But if you see, you're just looking for a pattern, okay? So when I tell you these keynotes, it doesn't mean they need to have all of them. It just means you're looking for a pattern. So if there's one or two they don't have and they've got three, that's still a pattern. But with thirst on bryonia, you've got this more of an occasional approach to drinking. But the real thing you want to look with bryonia is when we talked about this with a broken bone, everything is worse with movement. These people do not want to move. They are crawling in bed and they are not moving. And if they do move, everything feels worse. So if they move, the headache gets worse. If they move, the achiness gets worse. If they hold still, the headache gets better. The achiness feels better. As long as they hold still, everything gets better. Or it feels better with pressure. They want you to like push on the places that are hurting. Those are all indications that bryonia is the best match. Rhus tox is the opposite of bryonia. These are the people who can't hold still to save their life. They only feel better when they move. So these are the people that are going to lay down, sit up, get up, walk around, try to lay down. They can't, they get up, they go to the bathroom again, they lay down, they go to get a drink. They cannot lay down and hold still, because when they hold still, everything feels worse. And when they move, everything feels better. So bryonia and rust tox are like opposites as far as that you can look for. Arsenican album's kind of in the middle. This one has a restless characteristic to it too, but it's more of an anxious restlessness. Whereas rust tox, they're moving because they hurt worse if they hold still. Whereas arsenicans tend to be incredibly anxious, especially about illness and what's going to happen to them, and will they ever be able to get better, and that kind of anxiousness that manifests in a restlessness. And when they drink, they're drinking consistently, but it's just small sips. So that's kind of what that picture looks like. Phosphorus, there again, not as common. Those top three, I would say, are the most common with the flu-like diseases, but these others could factor in too. Phosphorus, weak, dizzy. A key thing you want to look for here is they want company. They need reassurance. They want someone to stay with them. Bryonia is the opposite of that. Bryonia is everyone get out of the room and leave me alone. And phosphorus has the tendency to want a cold drink, but when they drink it and it warms up in their stomach, they throw it back up. So there's another thing you can watch for. And then eupatorium, we've talked about lost already. It's when you feel like your bones hurt so bad that they're broken. And this can play in with flu. Eupatorium has been another key one with the recent flu-like disease to help with that achiness and the headache that goes with it. So that can be another good flu one. Can you use essential oils along with homeopathy? Yes, you can, but just don't do it at the same time. Same with herbs. You know, sometimes when someone's getting sick and we're doing that, hit it right at the beginning in the first 24 hours thing, and I don't know what it is, I'll hit it both ways. I'll do one of those hit it from the beginning homeopathics, and I'll do my favorite hit it from the beginning herbal mix, which I have a YouTube video on that too, my favorite antibiotic herbal mix, and I'll do both, and we can usually knock things out, but I don't give them at the same time. I separate them. So I might give a homeopathic, and then an hour or two later give the herb, and then an hour or two later give a homeopathic. And you just don't want to do it at the same time, and the same with the essential oils. Now, peppermint is a gigantic debate in the homeopathic world. There are people that feel like peppermint essential oil and peppermint extract and peppermint toothpaste antidote all homeopathy. Like that it's like the universal antidote, and if you use those, you will undo any homeopathics you are doing. And there are other people that believe that that's absolutely not true. So take your pick or experiment and see what you think, because there is no consensus on that. That's another interesting debate, but it's a big debate in the homeopathic world. Can you use peppermint oil and homeopathy at the same time? So go do a little reading on that and see who you want to believe. So now let's talk about the recent or current flu-like illness. You've got a couple options here. One, someone's getting sick, you just hit it with those first sign remedies that we talked about from the very beginning. You never even probably find out what it is. That's one option. Another option you've got is to treat it by its flu-like symptoms. And you go back to that flu list. I have gotten tons of emails and feedback from people about the recent illness, and things like gelsemium, rust tox, bryonia, arsenican album, eupatorium have been huge in success for people in that. So you can treat it like the flu that it is. Another option you've got is the Banerjees have developed a protocol for it, and there it is. It's very specific. No, you are not taking all those remedies at the same time. You are spacing them out over the day. You take camphor at the beginning because camphor is an antidote to almost all other homeopathic remedies. So you take camphor at the beginning kind of to clean the slate, and then you move forward with the rest of the protocol. Notice carbo-veg is being advised to be added if you're starting to have low oxygen issues, right? Because we talked about air hunger. Cali carb helps with that as well. That's three options you've got in treating the current situation homeopathically. If your question is, does it work? No one in my house has had COVID. There's multiple reasons that may be the case. So I can't give you personal, but I can't tell you how many emails I've gotten. Like, I don't even know how many emails I've gotten where this stuff has just made the world of difference to people. The more practice people have had with homeopathy before they've done it, the more successful they've been, just because there again, you've got a feel for it. But I've had people send me emails and say that this stuff kept them from getting lung scarring, even though they had really severe cases. I've had people who feel like it kept them out of the hospital. I've had people who've been able to get through it easy. So please note that it's an option. It is also an option for prevention. Now, this is a choose one of the above kinds of situations. Don't do all of these. But multiple people have found things that they feel have been effective in preventing coming down with it in the first place. The BenERGs recommend taking Thuja 30C twice a day for 7 days, and then twice weekly for 3 weeks as a preventive. Joette Calabrese, and she recommends taking Eupatorium 200C in water and just drinking that daily as a preventative. What we have done in our house whenever we were going to travel or something like that is I made a combo remedy in a bottle that had Eupatorium 200C and Thuja 30C, and we took that once a day for 3 days before we traveled. That's what we have done. Another option you've got that a lot of people have found effective is to use the Influenzium homeopathic remedy that's for flu and bacteria preventatively. And then the last one's interesting. This one is a plant. You can buy the plant. I've looked into it. It's very hard to find. But this is a plant, an herb that's been used historically for smallpox and been found to be very effective for treating smallpox as an herb. And this is the homeopathic version of that. So it's good for smallpox, chickenpox, a lot of those kinds of viruses. Some people have also found it to be very effective as a prevention for the current flu situation as well. So yes, please don't do all of those at the same time. You'll probably just confuse your body, but you've got a lot of options. So Pamela says, my husband and I had great success with the BenERG protocol. Great. I am so happy. I love those emails. They make me happy. I am happy. I am so happy when more people find out that there are simple solutions for complex problems. That is something that brings me joy. Okay, I just want to do a quick review here. Also, we're not going to get into this. I have separate classes on this, but mental health is such a huge issue right now for adults, teens, and children, all of the above. And we have used homeopathy for mental health issues on every person in my family. The one I told you that I had taken for that just dark cloud depression is called Arum, which, if you know your Latin, is the homeopathic remedy of gold. Isn't that amazing that gold would lift depression? I think that's just really interesting. It's for that, they call it the Arum cloud because it's just this very specific type of depression that feels like a cloud, and it tends to come with suicidal thoughts. And can you imagine if even if that was the only homeopathic remedy we had in the world, how much good homeopathy could do? I just want you guys to know, please, 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 if you have people in your world, if you or people in your world are struggling with mental health situations, please know that homeopathy is a very, very, very reliable and substantial and cheap way with no side effects to go about lifting. It really does feel like it's something is lifted. Like the more layers of some of these mental and emotional health issues that I'm able to work through with these remedies, it honestly, it's like it's lifting clouds, it's taking bricks off, it's taking weight off. It's just, there's so much power. And I'm actually going to be teaching starting next week a new class on using high potency homeopathy for deep trauma and chronic illness. if you want to take that class, there are some prerequisites, because I'm not going to teach the basics of homeopathy in there, and you need to already have a feel for how homeopathy works. Homeopathy can hit really deep trauma. You know, the trauma I'm dealing with my kids is deep, deep trauma. And with this other approach, we are finally seeing some breakthroughs in that. And I'm finally experiencing some stuff in myself that's just, it blows my mind. So please just know that this is also, though we're talking about first aid and general family illnesses tonight, please know that whether it's with me or someone else, it really doesn't matter. If someone's experiencing mental health, please look into homeopathy as a resource. It's incredibly powerful for that kind of stuff. Okay, question. When your husband helped you with your panic attack, were you advising him on which remedy to give you? Yes and no. There were some points where I could help, like the gelsemium I could. I don't think at the beginning I was able to help, but by the time I got to the shaky part, I'm like, okay, I know what that is, because I've used gelsemium so much with my other son that I was familiar with that one. I could recognize that one. But I have, in my other classes where we talk about mental and emotional health, I have printouts with the most common remedies for different things. And my husband went off that. He went off that paper. What would you recommend for general depression and anxiety? There isn't such a thing in homeopathy. Anyway, there is in psychiatry, I guess, but there's not in homeopathy. All depression and anxiety manifests with different symptoms. Seriously, when you're finding the right one, that you are going to be looking at things like, what are your fears? What are your phobias? What do you dream about? Where does it manifest most? Does it manifest in your gut, in your head, in your breathing, in your lungs? Is it speaking in public anxiety? Is it what they call anticipatory anxiety, which is anxiety before an event? All of those have different remedies for them. Okay, pellets or liquids. Here's the advantage, the pros and cons of both, because homeopathics come in both forms. Pellets, they are great for travel because they don't count as your liquids. So you don't have to put them in your little Ziploc liquid bag, which is nice. Those pellets are made of either sugar or lactose. There are people for which that's a disadvantage because they're trying not to eat sugar, or they're lactose intolerant or whatever. So that can be a disadvantage. The pellets will run out, and they're harder to administer. I have had children spit pellets at me. I have had them lock their lips and refuse to let the pellets in, because when a child really needs a homeopathic remedy, they probably don't want it. At least that's my experience. When they're getting out of control and I really need to intervene, they don't want it. So for me, I prefer the liquids. I can just put a drop on them somewhere. You know, I aim for the mouth because your mouth has got a huge amount of circulation to get contact with, but it doesn't have to be the mouth. So it just takes a drop. And when your bottle gets like half empty, you can just refill it with more vodka water mix, and you're never going to run out. So you're only going to have to buy them once ever, and you're set for life. And they're sugar and lactose free. So I personally, as you can see, I think the pros of liquids far outweigh the pellets unless I'm traveling. Do they have expiration dates? No. You know, like the saying that the only thing that will ruin salt is pollution. That's essentially how a homeopathic remedy is. The only thing that will ruin a homeopathic remedy is if it gets polluted. If something else gets in it, or, you know, it also can get interference from the outside. So most people recommend keep them away from your cell phones, away from electronic equipment, things that can interfere from the outside as well. But pollution's the only thing that'll ruin your homeopathic. When I make up homeopathics, I do it differently than most people do. I started with doing dropper bottles with the like a tincture that has a removable head, but they got contaminated because every time you pull that dropper off, if it touches anything, if it hit the kid's lip, plus you were opening it up to the air every time. And I found my homeopathics ended up going bad, meaning like you could taste them and smell them and they didn't seem right. So they had gotten contaminated that way. And so I have switched to using these little bottles like in this picture with an orifice reducer on them. because it's almost impossible for it to get contaminated. The way that works is you just turn the bottle upside down. The remedy doesn't even come out until you tap the bottom with your finger, and then one drop comes out. And so that's now how I do all my homeopathics, because it's the way I found that's the easiest to administer and the easiest to keep clean. But they're all equally effective. You know, there's sometimes where you'll get a protocol that actually says, take this one in the pellet and this one in the liquid. And I'm like, I don't buy that. You know, all you're doing is getting the homeopathic in your body. And I personally don't believe the form makes a difference whatsoever. So use whatever works for you. Someone's saying, keep them stored separately from essential oils. The potent smell can infiltrate. Yeah, you know, you're just trying to keep them from getting polluted. That's really all you're trying to do. Now, you want a kit, and here is why. It's the only way to really have what you need when you need it. I can't tell you how many people have called me after they came down with the recent flu-like illness to get what they needed. And it's like, yeah, I can still get you what you needed, but it would have been way better if you had it on day one. When you come down with something, or when you have it, you don't want to have to wait to order a homeopathic. You want it in your house. Now, none of us can have everything that we might ever need, but you sure can have the pretty core group that's going to give you what you need 90% of the time. And you want that, because when someone's hurt or sick, you need to be able to act. And the sooner you can act, the better the homeopathic remedy is going to work. It also is what allows you to practice. And I really absolutely believe practice is key with homeopathy. Some people, they just deal with one issue at a time, and then they order the homeopathics they need for that issue. But I have found, as I've watched that, I really don't think that works very well, because then if that one doesn't work, then you've got to wait and order another one. And it does, for me at least, when they're sitting in front of me, there is often a very intuitive thing of that one. You kind of, as you do this, you kind of start to form relationships with these remedies. You get to know them, you live with them. You aren't waiting to order this to treat this. It's like it's all right in front of you, and you can go, okay, this feels like the right thing to do, and you can do it right then. And if it's not the right thing to do, the second right thing to do is already there. And so you can move on, and it gives you this ability, this flow, and this ability to practice and start to learn to feel what the different remedies feel like, and what situations they work in and what they don't. And so I really believe that the only way you can get really good at this is if you've got a kit. Even if you start with a smaller kit, just to have some to start to form those relationships with, and to experiment with, and to get the feel of. It also saves you a lot of money. When you buy things in a kit, you're going to pay $3 to $4 to $5 for a remedy, whereas when you buy them individually, you're going to pay more like $5 to $12 for a remedy. So there again, if you only think you ever need aconite for your whole life, then just buy aconite. But if you're really going to use this for everyday life, and for illnesses, and for injuries, and for a first aid kind of thing, you're going to want more than that. And so it's cheaper to buy it in a kit. Like we talked about, if they're in liquid, they can last you forever. So it's a one-time purchase. And you can help others. This is one of my favorite things. People come to me and they need to borrow my remedies, or they need to use my remedies, and I can share openly in a way that I can't with my herbs, because herbs are finite. They run out. As much as I'm trying to grow as many medicinal herbs as I can, if there was an epidemic, I don't have enough herbs for my neighborhood, but I do have enough homeopathics for my neighborhood. And I love that. Like, I love how homeopathic remedies give me the ability to help other people. You know, when they come to my house and say, can I use this one? Can I get this one? I can say, yes. You can help so many people. So I absolutely believe that you want a kit. If you want to really embrace homeopathy, you need a kit. Now, what potency kit should you get? Now, this is one of the harder questions, because when you're buying a kit, they're all going to be the same potency usually, right? Like you're buying a 6X kit, or you're buying a 30C kit, or you're buying a 200C kit, or whatever the case may be. They usually come with all of the same potency. And so you've got to decide, okay, if I'm going to have kind of a core set that I work off of, what potency do I want them to be? So let's go over the different potencies, what they're kind of like, what you tend to use them for. Now, this is an overly simplistic simplification, okay? Because we're just doing an introduction here, but here's the simplification. Let's call it that. Low potency homeopathics are 6X or 6C. Occasionally, you'll see them in 12X and 12C as well. But the most common ones you'll see at the health food store are 6X and 6C. So C means that when it was diluted at a ratio of 1 to 99, 100 kind of resolution. And X means it was diluted at a 1 to 9 or 10, basically 10 part dilution. So an X is not as diluted as a C. Then the number tells you how many times. So a 6X has been diluted 6 times at a 1 to 10, and a 6C has been diluted 6 times at a 1 to 100 ratio. These are considered low potency remedies. These are really good for targeting organs and targeting very physical parts of the body and things like that. But these you usually take multiple times a day, every day for a very prolonged period of time. The way a homeopathic works is like throwing a pebble in a lake. A little pebble has a few ripples and it only lasts a second or two. A giant boulder is going to give ripples out for the whole lake, and it's going to take minutes or hours for those ripples to go away. That's how the potency of a homeopathic remedy works. The lower the potency, the less ripples. Now, that doesn't mean that higher potency is always better, because like we say, these low potencies tend to be really good at targeting very specific physical parts of the body. But because their ripples are going to wear off really quick, you've got to take them more frequently. So they're usually taken multiple times a day, every day for weeks or months on end. What's considered standard potency is 30C and 200C. You can usually get 30Cs at your health food store. 200Cs, once I've been told Sprouts sometimes has a few 200Cs, but rarely can you find the 200Cs as easily at a health food store. This is your standard potency, but there again, a 30C you're going to need to take more frequently than you would take a 200C. But these are really good potencies for general physical, emotional, and mental symptoms, and they're both safe potencies to experiment with. Like I say, if you do your 3 doses of a 30C or 200C, you're not going to do any damage. So it's really safe, and they're really good for a lot of different things. High potencies are your 1M, your 10M, and your 50M, and M stands for 1,000. So 1,000 dilution, 10,000 dilution, 50,000 dilution. These are for deeper issues and symptoms, and you need some experience and or a professional and a little more caution as you start to move into these higher potencies. But they can also get deeper levels, right? The waves are going to go deeper. They can get to deeper levels of things than the standard potencies can. And then you have what are called mega potencies, and this is CM, MM, and 10MM. So again, you've got to look at this from a Roman numeral point of view. CM is 100,000, MM is 1,000,000, and 10 mm is 10,000,000 dilution. Okay, so these are really potent remedies, and this is what we're doing the class on next month of using mega potencies, and this is for deep trauma. This is to get to the really deep stuff, the birth trauma, the PTSD, the abandonment. But the interesting thing as you study the deep trauma is that most of us who are dealing with chronic illness, it's because we've got unresolved deep trauma. That's what created the initial imbalance that allowed the chronic illness to develop. And so there can be some really effective things homeopathically by going back and treating the deep trauma to resolve chronic physical illness as well. So those are the different potencies. Now, 30C, I would say, is the most common potency out there. If you buy a kit from most commercial places, it will be a 30C kit. This may be my personal bias. I am not saying there is anything wrong with 30C, but in my personal experience, I have found 200Cs to be more useful than 30Cs. Once in a while, I've found something where a 30C worked better for a specific situation than a 200C, but I can count those on one hand. And I've got a lot more that I can count where the 200C was more effective. So personally, and there again, there's nothing wrong with having a different opinion or a different experience with this. I really do think different bodies sometimes resonate to different potencies. But I feel from my own experience and the logical side of me that if I was recommending getting a kit, I would get a 200C kit. It's my favorite all around potency for a kit. That's what my core I've developed. I've gotten a lot in other potencies now, but my core, what I started with everything was 200C. I have found that to be a good core. It's very hard to find 200C kits. So what I ended up doing when we did the first homeopathic class is we bought all these remedies in bulk and assembled them in the bottles to create kits. For people who take my homeopathic classes, we do have these group buy kits available. There's a 50-piece kit. This is kind of just your basic emergency remedies, right? Your core remedies. There's also a 100-piece kit that's kind of a more complete kit. I also have a kit that I have assembled of all the remedies for the protocols for the current flu-like illness. That's just the specific ones that are on those protocols that I showed you. And this way, you're paying $3 to $4 a remedy, so it's very affordable. So these are not something that I have listed publicly on my website or anything, but they are something that we've made available to people who are taking the homeopathic classes that I teach, so that you can build up your supply quickly and get into that place of being able to experiment and try and get a feel for the homeopathic. Now, I know you have a million questions, okay? So the most common questions: how do I know which potency to use and when? How often should I give the remedy? And most of all, could homeopathy help with fill in the blank here, or what remedy should I use for? I hope by now, by the end of this class, you realize that if you're talking about, I got a splinter in my finger, it's very easy for me to say, oh, well, the first one you probably would want to try is silicone. If you tell me you have chronic fatigue syndrome, or if you tell me that you've got autoimmune thyroid disease, I can't just off the top of my head tell you exactly what remedy to take. It's not that simple. And I hope you understand that now because of this whole thing of this remedy picture. What I can offer you is I do have more complete classes. My 6-week family homeopathy course, that has 6 classes where we go through more substantially the rules of homeopathy, how you figure out selection, dosing, frequency, and then we go through the different types of homeopathy, how to use the cell salts and the flower remedies, acute illness, mental and emotional illness, and some strategies for chronic illness. And then, of course, I have this new class that I'm starting where we're doing mega potencies for deep trauma and chronic illness. So if you're dealing with bigger stuff, I've got other classes where we can get in deeper. I'm still happy here to open this up and answer what questions I can. But if you've got a chronic illness and you're asking me what to take for it, you probably save yourself the question, because it's not something that I can or should answer in a 10-second response. Also know that if you take my homeopathy classes, we have a Facebook group where people do a lot more of that. Here's what I'm dealing with. Has anyone found anything effective for this? And there's a ton of give and take. It's a closed group, so we can do more of that safely in that. And I have another just a Simply Divine Eating community, which is open to questions on anything I teach on: food, herbs, homeopathy, fermenting, and any of it. So if you have questions for me after this class, please, 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 please use the Facebook groups, because I can't respond to all the questions individually in emails. But if you have a question, 10 other people have the same question, and if you ask it on the Facebook group, I can answer it for everyone together. Now, I understand there are some people who do not use Facebook, and believe me, I understand why, and it may not be that long in the future where we need to move to a different venue. But at the moment, if you can use Facebook, please do. You've got the link here, and it will be in the email to the family homeopathy class if you're interested. And you've got a coupon code here as well for that. Use code REMEDY, and it will take 50% off that class. So it's only $49 for 6 classes. I'm honestly making it ridiculously cheap because I just want people to learn this stuff. It's worth much more than that because you're getting 6 like 2.5-hour classes, but I just want to get it out to people. So those are additional resources that I've got. My approach when I teach is to try to take a complex subject and make it as concise and understandable as possible. That's what I do in all of my classes. That's my approach to teaching. So let's open it up now to 2 questions that I can answer for you guys. Is the mental health and chronic illness class different than your family homeopathy course? There, in the family homeopathy course, there's 1 week where we talk about mental and emotional illness, and which, just like we did today, where I gave you the most common remedies for first aid, we do the same thing, and we go through different mental, emotional health issues and the most common remedies used for them. So there's a class very much like today, but on mental and emotional health in the family homeopathy course. And then there's an introduction to different approaches that are used for chronic health issues also as a class in that. If you're referring to my deep trauma and chronic illness class with mega potencies, that's separate from the family homeopathy course. And the family homeopathy course or something similar is a prerequisite, because in the mega potency, we do not have time to go over the basics. What size are the bottles? They are 2 dram. Thank you that's probably Sylvia who answered that. Thank you. If we've already taken the family homeopathy class, can we log in and watch it again? Yes, whenever you get classes from me, they're forever. You can go back and watch them as many times as you want. Okay, recommending homeopathic doctors. That's a really good thing for the Facebook group. On the Facebook group, we've got a pinned post that has a few homeopaths that different people have used. Homeopathic doctors are all very different, and they approach things very differently. So there again, it's finding one that tends to specialize in what you do. For example, the one I just used most recently is one that specializes in homeopathy for special needs kids. And I needed some help with one of my sons, and she did an 1.5-hour interview, all the details we did. She had paperwork I filled out. It was a very extensive thing, and it's all focused on special needs kids. That's her specialty, but there's lots of different homeopaths that approach things lots of different ways. So that's something we discuss often in the Facebook group, and people can share what they feel are pros and cons of different people. How do I turn the pellets into a liquid? Just put some of the pellets, just dissolve some of the pellets in the water vodka mix in a bottle, and then let it sit for a while. And then you'll be creating a water version of your remedy. It's a lot easier to go from pellet to liquid than it is to go from liquid to pellet. That's harder.
Angie, I appreciate your knowledge and your willingness to share.
You are welcome. It is fun to teach things that really do help people. Okay, if you've got follow-up questions, you can use the Facebook groups. Right. Thank you, everyone. We will be in touch, and hopefully I'll get to see some of you in other classes and other situations. It's always fun to get to know more people.